If I change the angiography, she has different blockages. The right side वाली artery है, heart में ना 3 arteries main होती हैं. So as you can see, this is the capital. We check the line and the artery is C. ठीक है. You can see very tight blockage here. ठीक है ना? जैसे broad है, this part is. Can you appreciate that? हाँ ठीक है ना? So right side में तो ये blockage है.
And what is that percentage wise?
I would say more than 80%.
Okay.
तो ये लेफ्ट साइड की आर्टरी है. लेफ्ट साइड में 2 आर्टरीज होती हैं. So एक ये जा रही है, एक ये जा रही है. So now if you concentrate on this one, it is slightly narrowed here, but here it is very tightly blocked. I will show you another picture also. Now you can appreciate it more. So this is that artery. It comes here, absolutely narrow down here. Here's a branch which is also very narrow at this time, right? Now coming to the third artery. This is the third artery. Now this also has some narrowing here, but as you can appreciate, this narrowing is not up to that extent which we have shown in the other 2 arteries. So this also is around 70%, but 70% is a borderline thing. So I mean, ideally, so those 2 arteries definitely require stenosis.
Okay.
This, I mean, is borderline. Ideally should be done, but whether she is able to sustain 3 stents at one time. So in that view, we would like not to do this at this moment, and do they are the culprit for the pain. They are definitely the culprit for the pain. This is not, because as you can see, there is a good seen in the narrowing part of this.
Can I say everything back again?
Yeah, sure.
So this is on the left side.
Yeah, you can see this artery coming like this. Here it becomes very narrow, and it gives a branch which also is very narrow at the origin. Here, you can see this. So it should be this broad, but it's very narrow at the origin. So it gives it 2 branches, right? So this is on the left side. On the right side,
So this means one artery with one branch also. So you need to put 2 of them.
no, 2 stents. I don't think so. We will like to put only 1 there, and the other. Let's see. Normally we keep a wire there, and if that gets blocked, only then we put a stent. So the idea is to, the bigger one should be stented, the smaller one should be ballooned only. So this is the way to do it. And this is on the right side. This is the artery. This is the point. You can see this very tightly, right? So either of these 2 are the culprits. I mean, this or that. Because already the third one which I showed is not that significantly blocked to cause so much of pain.
That's
a
further small artery about
the small artery, the third artery. जिसको मैं कह रहा हूँ कि वो भी 70%. इनमें से तो कहना मुश्किल है कि which one is causing pain.
Okay.
But some of these is causing pain. So this is they are about to close down. So they need to be stented.
Okay. So as far as damage is concerned for the heart, how's that? Where is that stand?
I'm not sure whether we have done the echo right now. पहले वाला तो normal था. So once we open this up, we can compare it with the old one.
Okay.
And if the function is, it is possible that there is no damage because it is still flowing.
Okay.
It can cause pain, it can cause angina, but once it gets totally blocked, which is now it is at the stage prior to getting totally blocked. So when it gets totally blocked, then it causes damage and the heart muscle goes away. So now right now let's see if we don't open it up and it blocks here. So this whole area will be devoid of blood supply and this will get damaged.
Okay. So when it stops to
when it stops to
sit and oxygen,
उसको heart attack कहते हैं, पर heart को blood नहीं मिलता है muscle को. Right now it's getting blood supply. The pain is because it is getting blood supply less than what is required. So that causes pain. It is ischemic pain. The ischemia is there. Lack of blood supply causes pain. though it is still getting the blood supply through this narrow channel.
So, what do you suggest as of now?
I suggest that these two arteries should be stented right away. Because her enzymes are rich, so she definitely has some blockage, but because of which the enzymes have got released in the blood. And the third one, we take a call, maybe 2 days later, maybe 2 months later, but not now. Because the amount of dye also we need to regulate. Because now if we do angioplasty, we give more dye also. So considering her renal condition, so we like to give as less amount of dye as possible.
So, can I see this again? Can I consult with my brother? And
Yeah, you can surely do that. Yeah,
And can we do that tomorrow also?
no, that risk you have to take. We can keep her in the ICU on blood thinners, and let's hope that nothing happens. But whatever the risk is, even if it is 1%, 2%, 5%,
Risk is.
that you have to take.
Yeah, so like if I can consult, like we can consult today also. Like you will want to be using this?
Yeah, we can do it right now if you.
And how long will the procedure does?
Both these arteries probably should take around 45 minutes.
So it's not a very major big.
See, right now the catheter is in, the sheath is in, so you have to enter the artery, wire it, balloon it, and stent it. So, I mean, not major in terms of time required, but in terms of patient and cardiac condition, it's a major thing to open two arteries. So there is no surgery involved. We can go through the catheter only, cross it with a wire.
What you're saying is we now get this again.
The catheter is not in, the sheath is in, through which we have to enter. So that is in. And anyways, this is so tightly blocked that anyway the recommendation is to open it up. So other than your consideration that is second opinion or a consultation to mediators, otherwise ideally if it has to be opened up, it should be opened up as early as possible. So what we can do is, if you believe us, you can allow us to go ahead, we can give you the CD and the reports. And I'm pretty sure that everybody would say that yes, it was required at that time. But if you want to do it beforehand, then also we are okay. Whatever the little risk is, you can keep her in the ICU, you can take the CD from us, you can take the reports from us. But then overnight, whatever the risk is, then you should understand and ready to be taken.
So when you say the risk overnight means that.
Yesterday she had the pain, so that means she was having. So now the risk is that it may get blocked. So I see these arteries are going to get blocked someday. That may not happen for next 6 months, but that can happen tonight. So the rule is that any artery which is impending to close, more than 70% should be stented. So these are the two arteries which are impending closure is imminent. So ideally it should be done right now with troponin raised. That actually means a heart attack. Troponin raised means a heart attack by definition. So she has suffered a small heart attack, maybe minor one you can say, because the artery is still flowing. So the recommendation is to open it up. Medical recommendation is this, that such kind of patient should be opened up as early as possible, immediately. But I mean, if you want to take this, I mean, you can take that call, but you should understand the risk and take the call.
Yeah, that's what I'm asking you. Like when you say the catheter is in, this means the whatever the tube is in, whatever thing is in, through which that you will be inserting the.
The sheath is in, yes.
That's for sheath.
The sheath is here from where we enter. We do the diagnostic angiogram, and like for the left we insert one, for the right we insert one. After the angiogram we take out that catheter. But we enter through the sheath, which is the opening, which is our gateway to entry.
That was from the very
Yeah, that is there.
Okay, that is going to stay there till we decide, or this, you take it out if I say.
Yeah, if you say that we are not going to get it done today, then we are definitely going to take that out, because keeping that inside in a leg can also cause clot formation and thrombosis and damage to the leg for a very long period. Otherwise, if we do angioplasty, then we are going to keep it there for 3-4 hours because we give a lot of blood thinners. But otherwise, we will take that out. There is no recommendation to say that keep it overnight and decide tomorrow. No. It has to be taken out. Then it can be reinserted. That's not a very big deal.
That's what we decide by tomorrow. like not today.
See, that's not a very big deal to reinsert it again. That should not be the prime consideration for taking a decision. The prime consideration is that these arteries are very tightly blocked and we don't want to take the risk that we keep her overnight without opening them up. So that is of prime consideration. Putting a sheath or taking it out can be a minor swing, minor factors to sway your decision, but that should not be the major decision.
So, okay, so I would like to still have a little opinion.
Yeah, sure.
About, so if we take, say, another half an hour or 1 hour, is that fine? Is that something which you would motivate or?
No, that's okay. No, that's okay. I mean,
fine.
then we will not take out the sheet. See, we have to do another case. We can shift her out. We can shift that case inside.
Mm-hmm.
By the time you finish that case, you can take a call.
Yes.
And
then
then
little report I'm concerned with my.
you can make a video of it also on your phone and WhatsApp it. We are open to that. The report you want, we can give that. No, I mean, whatever you want, we can do that. That should be. Yeah, that whatever is easy and feasible for you to send or if the person is coming here, then he can see this also. Otherwise, you can make a video of it and WhatsApp it. You can get a printed report also. Everything is fine.
Yes.
No problem. So what do you want?
I want to have a printed report.
Report.
I can make it a video also.
Yeah,
These
sure.
things.
Sure.
And give me an hour or so.
Sure.
Or an hour and a half. Then we can slide it.
Sure.
So apart from that, like put this stuff inside. So what are the precautions that she need to be on breathless or they're lifelong with that?
See, whether we put in the stents or we decide not to put in the stents, she has to be on blood thinners. Whatever the precautions are because of the blockage. Precautions are not because of the stenting.
Okay.
So if a person has a blockage, then there are not many precautions to be taken. That it should not happen again. So whatever the precautions are, they are there because there is a blockage. After opening up, as you can understand, the precautions will slightly decrease, they will not increase. Like now, if you ask me, I will not allow her to roam around, I will ask her to have bed rest. But once they are opened up, I'll ask her to move around and exercise.
She will be normal as a person.
She should be, yeah, she should be. Because if there is a blockage, then she's having pain at rest also. So we don't allow them to go for a walk or something. But if we open that up, then we encourage them to walk and do some physical activity.
So let's give me I'll make a video of this.
So now you understand that she has a heart attack because the trauma is raised and there are 2 critical blockages. And we want to wait for an hour to take a second opinion. That's okay. So you can make the video, I can run it for you.
इसका कोई ऐसे सीडी लगा तो होता है या सीडी ऐसे चल रहा है?
CD भी मिल जाएगी आपको.
Should I start?
But this will keep on running. You can make the video. This will keep on running. Okay, that's it.
So
this is the easiest way to send the envelope.
okay. So as far as concerned, like regarding
Info na?